elevator. That elevator from Dowell brand will allow me to detach a little bit the periodontal ligament from the buccal root. And since this is a very straight root, it was with just a circumferential movement, I was able to remove the root in a pulling motion, in a pulling movement. So another thing is to use elevators that are Atraumatic elevators, such as this one from Dowell, that actually have a very, very good grip, and an arrow tip shape allows me to access in areas of difficult access with regular and standard elevators. And as you can see in the image, you can see how the tooth is starting to move. However, I prefer to give a little bit more space for the tooth movement. That's why in these cases I use a high-speed burr in order to reduce a little bit the size of the crown, so I have a little bit more space for that mesial and distal movement. I'm always trying to avoid buccal-lingual movements, movements of my teeth, in order to avoid any buccal damaging the buccal plate of the tooth. And in order to do that, I will always encourage initially my mesial and distal movements. I will always emphasize on mesial and distal movements. Once I have a space, I can do circumduction, which combines buccal palatal with rotation as well. And since I am within the alveolus and post-extraction socket, I'm able to give a little bit more movement of the tooth. And along with that pulling effect, I can extract the